March. This idea of social distancing measures isn't unique to Washington state. In fact, the director of the National Institute of Allergy and Infectious Diseases, that's Dr. Anthony Fauci, spoke about it with our Dr. Jon LaPook last night for 60 Minutes.
In China, millions are quarantined. Is that where we're headed here in the United States?
I don't imagine that the degree of the draconian nature of what the Chinese did would ever be either feasible, applicable, doable, or whatever you want to call it in the United States. I don't think you could do that. The idea of social distancing,
yeah.
I mean, obviously that's something that will be seriously considered depending upon where we are in a particular region of the country.
And Dr. Jon LaPook joins us now. Doctor, good morning. So if we're not going full quarantine, we're going to do social distancing. What is that exactly?
It's just trying to keep yourself away from other people, especially large crowds, schools. You know, what do corporations do? Should you be doing teleconferencing and things like this? We know from past epidemics, including the 1918 huge flu epidemic, that it kind of works. You know, different cities that did a lot of social distancing did better than those that didn't.
In your interview with Dr. Fauci, he says quarantines are not doable in this country. He doesn't say they're not necessarily appropriate.
Right, and if you see in China, you know, there is a leveling off of cases. You know, it's a big country, so it may be effective. And as Dr. Fauci told me before, this is a huge, it's never been done on the scale that it was done in China, where tens of millions of people are in quarantine.
So are we past the point of containment? What should we be doing at this point?
You know, I think when we have the millions of test kits that Dr. Fauci said we need, we'll get a better idea. We'll get our arms around exactly how widespread it is. And the chances are that it's out much more widely than we think it is or that we've documented. So then we're talking about sort of logical steps. And I think social distancing makes a lot of difference. It makes a lot of sense. And I think corporations have to start thinking about things like, okay, how do we protect our most vulnerable population? So if you have people in your corporation, for example, who are immunosuppressed, who have these chronic diseases that are serious, that could increase your chances of getting serious disease, maybe consider having them at home, working from home, paid, because there's a financial hit, and also it shouldn't count towards sick days.
Right.
And so we need to start thinking about these things as a society, and it can't just be, well, I'm going to do this and another person can do that. We need national leadership to say, okay, here's an algorithm. Here's a way of logically thinking about this.
If you are in that vulnerable population, what should you be doing?
Well, what I'm telling my patients is, you know, I think you should use your common sense. You can't obviously hermetically seal yourself, but I would stay away from large crowds. If I had somebody who's immunocompromised, this is not the time to go to the theater. This is not the time to do things where you could possibly be exposed. And as Tony Fauci said, this is certainly not the time to go on a cruise ship.
What can people do to protect themselves beyond washing hands and this social distancing technique?
You know, I don't want to minimize the social distancing, and I don't want to minimize the washing hands. So I was just reading something that said, in past epidemics, in past flu epidemics, washing your hands, I know it sounds so simple, it can make a huge difference. It can decrease the amount of deaths and infections dramatically. So that's something that people should do. We know how it's spread, which for the most part by droplets, right? So don't think magically. Usually within about 6 feet of somebody, you're going to get it. And I would say if you want to do something extra that we're not talking about, sleep. We know that sleep improves your immune system.
I just have to point out that Germany has about twice as many cases as the U.S. and only 20. We have 21 deaths. They have 0. What are they doing right?
Well, remember that we haven't done enough testing here. So when you think about the mortality rate that you're hearing, what's the true denominator? If it turns out that it's a lot more people out there that have this infection than we realize it, then the mortality rate, if you're talking,
lower,
it's a lot lower. So we still don't have our arms around this.
That's the big problem, is we don't really know what we're dealing with.
These kits are crucial. Right now, we're kind of flying blind as a physician. Somebody has a sniffle, they have a cough. What is it? I want to be able to test them. So I need the tools of the trade.
All right, Jon, thank you.